Welcome to Bench to Bedside, a weekly series of live conversations about recent advances in cancer, from the research bench to treatment at the patient's bedside. And now, your host and the director of the University of Kansas Cancer Center, Dr. Roy Jensen.
African Americans have the highest death rate and shortest survival rate of any racial or ethnic group in the U.S. for most cancers. The factors surrounding such gaps in cancer are interconnected and complex. Better understanding health disparities is critical to progress against cancer. Scientists at the University of Kansas Cancer Center are working hard to overcome these hurdles, and they're doing it in unique ways. Through a consortium called Thesis Work, researchers, church leaders, and church members come together to spread the word about the importance of prevention and cancer screenings. Thesis Work includes more than a dozen churches and faith-based organizations and has served as the foundation for many community-based research efforts, publications, and grants. Good morning. I'm Dr. Roy Jensen, Director of the University of Kansas Cancer Center, and joining me this morning are Dr. Crystal Lumpkins, Director of the University of Kansas Medical Center's Thesis Work Community Consortium, and Dr. Lynn Miller, a member of Thesis Work Connecting for a Healthy Consortium, is with us via Skype. Also joining us via Skype is Megan Peters to take your questions. So first of all, welcome, Dr. Lumpkins, and I'd like to hear from you this morning. What are some of the barriers that you feel are limiting African Americans' access to cancer care and prevention activities such as screening?
Yes, and first I'd like to say thank you, Dr. Jensen, for allowing us to be here this morning, and also Dr. Miller for joining us. In your opening statements about the gaps to cancer care, the interconnectedness and the complexity, when we think about that, that's also the barriers to access to cancer care and also prevention. And so when we talk about barriers, we cannot talk about barriers without talking about the social determinants of health. And so among African Americans, some of those unfortunate barriers include things such as insurance, lack of insurance, underinsurance. And when we look at social determinants of health among African Americans, it's even more complex, and other racial ethnic groups as well. But there are structural issues that many social scientists, such as myself, are also looking at, which are the structural issues that I talked about, but also implicit biases, some of those things, and other factors that we don't even think about, such as neighborhood, zip codes, as you know, we've talked about how just living in specific zip codes actually spells or is indicative of lack of access to quality care. So many of those things, Thesis Work, Connecting for a Healthy Community, has been instrumental in trying to address that. For instance, an example is a study that we conducted a few years ago with a sample of African American men as it relates to colorectal cancer screening. And so when we conducted this qualitative study, these individuals, just the thought about colorectal cancer screening, it was scary. And so those are psychosocial perceptions, also are barriers to screening. And so these individuals felt that, especially those invasive procedures, such as a colonoscopy, which we know is a gold standard for detecting colorectal cancer, they felt that this was an affront to their manhood. They also, there was distrust among medical providers, not because, and some of the individuals in these focus groups said, well, relationship is really important. But some of those individuals couldn't even get to that building a relationship with a physician because of those perceptions. And so what we also found in that project, as well as when we asked questions about the faith-based organizations, such as churches, there was a feeling of, yes, this is something that would be very beneficial to approaching and discussing and talking about barriers, because these organizations are many times woven into the life of African Americans. And so they felt that these entities were poised to be co-promoters, co-educators with those medical providers that can talk about colorectal cancer and addressing barriers to access to colorectal cancer screening.
So that's really great information. You know, I suspect when most of our audience is thinking about, cancer researchers, they, it's like people toiling away, rattling test tubes in some, lab bench someplace. And your research actually takes place in churches. And I suspect they don't have a lot of test tubes in your church or any other church that I know of. So tell us a little bit about your program and how your research, fits in with that environment.
Thank you. Absolutely. Well, I'm a social scientist. And so I do want to say that there is, I really appreciate the lab scientist because all of us have a role that we play in addressing cancer throughout the cancer continuum, from cancer prevention to palliative care. But as a social scientist, applied researcher, society is my laboratory. And so I'm able to just look at patterns and then talk through surveys and focus groups and talk to individuals about their perceptions, their opinions about, like we mentioned, the access to care. And the approach that I take as a social scientist is called CBPR, or community-based participatory research. And so that type of research for my own, and I have learned from the community, it is actually embedding the community, for instance, African American faith communities, in the process throughout, from identifying that research question, how can we address these barriers, to the data design, or the research design, the data collection, and data reporting. And so it is somewhat complex because it is longitudinal, but the value in that type of approach is that those voices are at the table. And it is a diversity of perspectives that we're addressing issues. And, we as scientists, yes, we are experts in what we do, but the community, those voices, they are experts in life, and in particular, the African American experience.
So next we want to turn to the newly minted Dr. Miller, I understand. Congratulations on just receiving your doctorate recently. My understanding is that you've been involved with Faith Works since the outset. Tell us a little bit about how you became involved and how has your participation evolved over the last few years.
I'm so excited to be here. I met Dr. Lumpkins in around 2010 at a Baptist Ministers Union meeting. And that's where Baptist ministers get together and meet and talk about different issues and things going on in the community. And I was presenting to them information about our church camp and what a wonderful opportunity it would be for their churches to utilize our camp facilities. And Dr. Lumpkins was there, and she was doing a presentation about health disparities and research and data and obtaining this information in the African American community. And this was something that I had a concern about, but I had a lack of knowledge about who to contact, how to do it, where to get this information. I was what I call medically illiterate. And I just didn't know how to approach the issues. So all while she was talking, my mind was racing and I was having all kind of epiphanies all over the place. Honestly, my mind was just completely out of control because I knew I had to find out more about her project and how I could get involved. And so after her presentation and after the meeting was over with, and by the way, I knew her father because her father was a friend of my pastor. And we got together and we met and we talked and we became great friends and compadres in the fight against health disparities in the African American community. And ever since then, she's been what I call my healthy home girlfriend. And so I just appreciate all the information, all the networking, and all the confidence that I have obtained from our connection and our relationship.
So, Dr. Miller, could you describe for us the role that the African American church and its leaders play in influencing the health of the African American community?
Well, the African American church, in my opinion, is the foundation of the African American community. And not only is that my opinion, but it's also stated in a lot of books that were written on the subject. I have the ideology, like one of the songs says, "Can't nobody do me like Jesus," that we sing in our church. And that song is based on the fact that African Americans, in the midst of oppressive, traumatic, unjust, and inhumane social system, it is Black folks and the Black church that has helped us maintain hope. The Black church and faith in God, I believe, as well as many others, show how we as a people have overcome and are still overcoming social, physical, mental, emotional, educational, and occupational systemic racism, which affects our health and our health access. So from the onset, I can say, who but the Black church can better articulate hope to people who are in this kind of situation? Who but the Black church has developed, implemented, and carried out a legacy of hope, countering the legacy of trauma in the Black community? Who but the Black church is better situated and suited to assist African Americans of every generation to be healthier? And my focus is on the legacy of the Black church and its effect on the next generation. If she, the Black church, has been the place and provision for Blacks in the past, then she still has the responsibility and the ability, in my opinion, to be the same stronghold for our future.
Extraordinarily well put. And if you're just joining us, we're here with Dr. Crystal Lumpkins and Dr. Lynn Miller talking about Faith Works, a research program that brings science and religion together. Also here is Megan Peters, who is joining us via Skype to take your questions. Please remember to share this link with people you think might benefit from our discussion and use the hashtag #BenchToBedside. Megan, I understand that we already have our first question.
Track the progress and successes of Faith Works over time.
Yeah, we couldn't hear your audio for the first bit of that, Megan. Could you say that again?
Sure. How do you track the progress and successes of Faith Works over time?
Dr. Lumpkins?
Yes, thank you so much for asking that question. What we have done to track our progress is through our scientific presentations, also our publications, and then also evaluation with our consortium members. And so it's important that we do that. So I thank you for that question because we want to be responsive to our consortium members who are representatives of our community. And I don't know if Dr. Miller wants to also add in.
Sure. Dr. Miller, would you like to add anything to that?
I think that's very important because once you obtain the data, then you can go back to the community and tell the community your findings. And then that gives people information and access. And that's what we want to do with FaithWorks is break the barrier down of not having that information and not having that access. So collecting that data, getting that information, understanding what people are thinking, what people are experiencing, putting that on paper, and then being able to present that to the community is so vital. It's so important. And it helps the community rally around ways and means for stopping and bring a halt to the disparities that they're experiencing.
And could I just
Sure.
add, so I thank you for saying that, Dr. Miller, because it made me also remember the importance, again, going back to that CBPR process and going into the churches where they are, for instance, holding a service and appropriately, not now, but appropriately sharing in person some of those research results and then how that does apply to the situation at hand, such as the access. And then another part is also those community research forums. That's something that when Dr. Daly was here that she did with the American Indian population. And that's something that we have done as far as having informational sessions about cancer-related issues.
Mm-hmm. So, Dr. Miller, as we mentioned at the top of the show, you just completed your doctorate in ministry, and I want to offer my congratulations again. And I'm wondering if you would share with us a little bit about your thesis work and discuss how your findings support the case for programs like FaithWorks.
Well, most people with PhDs, especially in the humanities, are pursuing full-time careers in academic settings, focused on teaching, research, and writing. Well, from my perspective, the DMin purpose has goals where we are applying them to the ministry settings where we work, where we minister the population that we have been called to serve. And so we want to apply that existing research, and I'm going to be applying that existing research to create fresh solutions for the church. My thesis was on how the Black church can work better with the next generation. And so my goal is to increase and focus on the next generation of Black faith leaders and empower them and empower the church today to empower them. In my research, I read an article, and this is the kind of like what got me going with that particular topic by Emmett G. Price III in his book called The Black Church and Hip Hop Culture. And Price made a statement that just blew my mind, and it set the course for my research. He said that the Black church is the only space that can play a key role in reversing the detonation clock on self-imploding dreams of all generations. Now, when I saw the word self-imploding dreams, I said to myself, that is talking about disparities, health disparities, all the social determinants that African Americans have experienced. And so he goes on to say that no other institution with all its faults and challenges and failures can issue the challenge to all generations and receive a response. And so I received from that statement my clarion call, and I wanted from that point on to spend the rest of my life, I guess you could say, trying to find ways to help the Black church reverse the effects of systemic racism, especially as it applies to health disparities.
So, Dr. Lumpkins, when it comes to conveying the importance of cancer screenings to diverse communities. I think one lesson that all of us have learned is that the one-size-fits-all approach is not one that's going to be terribly successful. Why do you think it's so important that we carry that lesson forward when we're trying to tailor our strategies to specific audiences?
Absolutely. Just piggybacking off of what Dr. Miller said, specifically African American faith populations, taking a one-size-fits-all will not work. And so it is just imperative to be inclusive of those faith leaders, to be inclusive of those community members that have, again, lived those experiences, and embedding that into the research process. And so from the one of our first NCI-funded studies was actually looking at how the church is poised to be a communicator of colorectal cancer screening and prevention. And so having that's culturally tailored, it was an efficacy trial, but having a communication intervention was very responsive to addressing some of those long-standing issues such as mistrust, such as fear, and as Lynn touched on, being an oppressive state, and looking at how empowerment, specifically among African Americans, is so critical. And so that is one of the things where this one size fits all. And I know that we as scientists, again, going back to an earlier statement, I said that we are experts in what we do, following that type of process. But it is very incumbent upon us to also adopt a process, at least social scientists, a way that we are responsive in this way.
Mm-hmm. So, Dr. Lumpkins, I'd follow up on that with, kind of pointing out, as a result of the fact that we're the only NCI designated cancer center in the region, we are specifically charged with ensuring that we meet the needs of all individuals across our catchment area, and particularly in regards to those that have the greatest need.
Yes.
And so perhaps could you tell us a little bit about how programs like Faith Works help us meet that mission and really serve those in our community that have some of the greatest needs?
Well, first I'd like to say just so appreciative of you and the just KU Cancer Center and the support that we have received to be able to be positioned to be responsive to the needs. Mm-hmm. Individuals like, I would be very remiss without mentioning Broderick Crawford, who is the inaugural KU Cancer Center Advisory Board Chair. And his inroads have been incredible. Hope Crable, also with our community outreach engagement core, being a part of that, has been very important. And Faith Works, because of the individuals like Dr. Miller, and so many others, like I can think of, and I'm probably going to get in trouble with naming names, but some of the consortium members like Dr. Jones and First Lady Jones at Bethel Baptist Church, that are very connected into their communities and have the trust, the ear, the hearts and minds of their community, and then are also connected with regionally. And just having that structure and those inroads allows Faith Works to not only be in a position to help out research-wise, but also other things. And when I say that, again, I keep probably repeating the CBPR approach, but as we know, it's more than research. Research is critical. It's important because, as Dr. Lynn said, Miller said, the data is so important, but there's also the other things that Faith Works has been able to partner with, such as health fairs, such as educational cancer workshops at Palestine Senior Activity Center, and walking in 5Ks. So I think it's like FaithWorks is positioned as a consortium that cares, as corny as maybe has that sound, but it cares and it wants to be responsive.
Mm-hmm. So we're approaching the end of today's show, and I want to hear from both of you. What's your favorite story coming out of your participation and work with FaithWorks?
Wow, that is a good question. I have so many favorite stories, but what is top of mind? It goes back to actually a congregation where there was an individual, and I'm sure she doesn't mind me using her name because she wanted me to use her name as a testimonial of the research and how much it impacted her, Donna Johnson. Mm-hmm. And so her church was involved in the project that I mentioned that was funded through the National Cancer Institute. And she said, before this project, I heard about colorectal cancer screening. I heard about colorectal cancer, but it wasn't until going through this process. Unfortunately, it was a positive ending, but cancer was found. But because of that project, sorry, this just touches my heart. Because of the project, she said, "Thank you, Dr. Lumpkins." That was caught, and that meant the world. And so she was is a testament to what we do, and that story was also something that was ran in a journal. But I think about that and I say, if we can touch that one life, how many more people that we're touching?
Mm-hmm. That's a great story. All right, Dr. Miller, you have a tall hurdle ahead of you. Try to top that one, okay?
Okay, I think I can. No, we don't compete, but I'm proud and of the information that FaithWorks provides to the community to make healthy choices, and the resources that we provide and the connections that we are providing in the medical field. And I love that at KU, Dr. Lumpkins connects us with young people in the medical field, young researchers, young doctors, just young people throughout the medical field, so that now not only are we affecting the present generation, but we're also affecting future generations. And I almost jumped out of, and she'll tell you this is the truth, I almost jumped out of my skin when she introduced the cancer-related genetic counseling program that FaithWorks is implementing right now, which will impact an entire family about their cancer history. And can you imagine how that will begin conversations in families about their health, how that will open up health and resources to change family health dynamics, and how this is seriously going to change the medical paradigm that has been a long time coming in the African American community. And just thinking about that genetic health counseling program just gives me goosebumps, because it's just the beginning of something that I think is going to make a great and powerful impact in the Black community health-wise, not just with cancer, but I think it's going to open up opportunities to talk about diabetes and talk about what we eat and why we eat what we eat, and how are we going to change those kinds of things, and how families can even start doing things different, gardening, raising their own food, doing the turmeric, finding out about that. That was on another program that you had. So those are the things that just excite me about FaithWorks.
All right. Well, I'm going to declare that a draw. And I understand from Megan that we have at least one more question.
Yes, we have a couple more questions. And I also want to pass on, there's some congratulations in the comments to Dr. Miller. So wanted to pass that along as well. The first question is, how can we contact the FaithWorks program for community outside the Kansas City area for information and possible application?
That's a great question. I would say to start off with contacting the number, if that's okay to give that
sure.
number,
Yeah, yeah.
913-588-1919. And then we also have the website, which is faithworkskcs.org. So that's the first way that those that are wanting to ask more questions about the program can do so.
Great.
Yes.
And next question, Megan?
Question is, how do you work with online and social media groups and organizations to provide resources and access in an evidence-based manner? And they also say thank you for this great presentation.
Okay, so I guess the question is the research that we are conducting to utilize social media. So I guess I want to make sure that I'm
I think it may have been the question may have been a little broader about how we, trust internet sources in terms of getting our information. So I'll let you take a crack.
Yes, that is an excellent question because the internet, as we know, is very pervasive. And so there's multiple factors here as far as I'm thinking with, the populations that I work with. The credible sources. So, for instance, we know that the CDC, being in the pandemic, is a credible source. But then also we face with social media, Facebook, where there are individuals that if such and such says a trusted person has information, it's maybe it's trusted, but do we know if it's actually credible?
Mm-hmm.
Do we know if it's correct or right? And so that is absolutely an issue. In fact, we've talked about this where, Lynn talked about the cancer-related genetic counseling and testing, and which we get into genetics and all of that. But I would say for us, it is important that education is educating those leaders, those trusted leaders that we talked about, and also being very intentional with pastors, for instance. And we have a study on that, actually published in, I'm trying to remember when, but asking leaders how they see themselves as health communicators. And as we are in a social media age, internet age, they recognize it is really important that they are informed and that they are being in the forefront and giving credible good information through social media.
Right.
So I hope that answers the question.
Yeah, I think it does. And I would just remind folks that the KU Cancer Center website, we certainly endeavor to be a very credible source of information. And if you submit questions through that website, we will identify the appropriate expertise to provide an answer there and to get content up on our site that addresses issues that our community finds important. So Dr. Lumpkins and Dr. Miller, thank you for being part of this week's episode of Bench to Bedside. And to learn more about the University of Kansas Cancer Center's outreach and engagement efforts, visit kucancercenter.org/community. That's it for today. Join us next week at 10 a.m. for Bench to Bedside. Thanks for watching.